Hi, I'm Dr. Thomas Burwinkel at the Institute for Reproductive Health in Cincinnati, Ohio. I'd like to speak to you about clomiphene citrate therapy. This is one of our agents that we use for low-tech treatments. The workup before we go on to low-tech treatments involves several simple tests. One of them is a semen analysis to make sure that there's adequate sperm to move on to this type of treatment. Other testing may involve looking at your thyroid and some other hormone levels to see that this treatment is appropriate as well. And one last test that can be appropriate is to do what they call hysterosalpingogram, which is an X-ray test to make sure that your uterus is okay and the fallopian tubes are open. If these are all within the normal range, then we can consider the low-tech treatment with clomiphene citrate. Clomid, or clomiphene citrate, has been around for 50 years. It's been the mainstay of fertility treatments for a long time. Most of our pregnancies actually occur from clomiphene citrate. So don't look at yourself as being less than perfect by moving on to IVF. This is where many patients start. The treatment with clomiphene citrate involves taking the medicine, which is an oral tablet, for about 5 days during your early menstrual cycle. After a few days, we can do an ultrasound to watch the follicles that progress due to the clomiphene citrate medication. When the follicles get big enough, we can trigger the ovulation with a medicine, and we can time an insemination with sperm at an appropriate time interval after this medication. This increases your chances of success. Normally, when you've been infertile for a year or more, the chances that you'll conceive in one cycle is 1 to 2%. With the clomiphene citrate treatment, we can enhance your chances to 13 to 15% per month. This is quite an improvement over that 1 to 2%. The theory involved with this is that we're increasing the number of eggs that you make with the medication. These eggs, after you take the HCG trigger shot, gets these eggs into the fallopian tubes, and when we take the sperm and wash it and put it into the uterus, more of the sperm are going to get out into the fallopian tubes where the eggs are present. Getting more sperms and more eggs together is what enhances your chances. This treatment is appropriate for unexplained infertility, patients with minimal or mild endometriosis, mild male factor infertility as well. So please consider these options for your treatment. If you have any further questions, reach us by looking at our website, cincinnatifertility.com.